Avila.
Avila.
Yeah.
Hey, welcome everybody to the Righteous Dad Podcast. Thanks for tuning in. Today I have a special co-host, Doc Soto from MVP. You know him from episode 1. But I'm very, very, very honored to have Auric Avila in today as today's guest. And ever since I've been doing this podcast, I wanted to get these guys together to be able to talk to each other. So welcome, guys. Thank you so much. Good morning. I hope
Right
you
on,
guys are
thank you.
having a great day. How are you doing?
Doing well, man. Thanks for having me on. I appreciate you taking the time to get us all together and keep spreading the word about what's going on in the world and see what we can do to help out, man. I really appreciate you doing this.
Keep being that righteous dad, brother.
Yeah, you don't have to be a dad. You could be anybody, but here we're just trying to bring stories and people and books that just inspire people to live a better life, to have a goal and to just find happiness. So I think with both of you gentlemen, you guys are pushing that too, and then you guys are pushing it in unique ways. Doc Soto through the virtual reality and the social interactions with My Veteran Passion, but Auric Avila, I wanted you to be able to tell your story and the awesome things that you guys are doing over there in Utah at Ketamine SLC. I know you're the director of the clinic. So how did that go about? How did that happen?
Yeah, it's kind of an interesting story actually. But let me rewind a little bit to kind of give a little bit of backstory about who I am and how I got to this point. So I served a little bit over 8.5 years in the Marine Corps. And during that time in the Marine Corps, I, suffered some things that I didn't even recognize until I was long out of the Marine Corps that I was actually suffering from them. Mostly related around PTSD and depression, anxiety. Didn't even know what those words meant until after I had gotten out, and it was more people telling me, "Hey, you should probably get looked at for these things." And I didn't realize it until after, like I said, after I got out, that I was experiencing these things while I was on active duty. A lot of drinking, a lot of, trying to escape the daily grind. You'd go in there and you'd do the work, but then at the end of the day, it's like you're stuck with your mind and you're stuck with your past and you're stuck with what's going to happen tomorrow. And all those things just start building up on you. And you create this, almost hell in your mind of what's going on and what's happening. And so after I had gotten out, I was drinking really heavily. I was probably, when I was on active duty, I was sitting around like 180 pounds, and I got up to 230 pounds just from drinking and just beating myself up because I felt certain ways. I'm now sober going on 8 years because I realized that wasn't serving me. Now, after, getting sober and change a lot of things about my life, I still had those mental things happening, where I'd still hit those really low points and not know what to do, so eventually I got to a point where, friends and families like, you need to go get checked out. And I went to the VA and I remember I talked to the lady and she was like, have you ever been told you have PTSD? And I said, fuck you, I don't have PTSD. And she's like, there it is. And I'm like, oh shit, so I should probably get this looked at. So they threw me on a bunch of different antidepressants, anti-anxiety medication, just stuff that really slowed me down. I don't feel like it ever helped me. I feel like I actually got worse on it because I was in a position of, I have to be in front of people and I got to talk to people and I'm just like lethargic. It wasn't doing me any good. And so years gone by, and I had a buddy that was telling me about this clinic out here in Salt Lake that uses ketamine to help people with depression, anxiety, and PTSD. And from the stigma of ketamine, everybody thinks it's it's a horse tranquilizer, it's a rave drug, it's all these bad things, and nobody really talks about what the benefits of what they've been doing with the research of it for the last 20 years. And what they found in the last 20 years is low dose ketamine actually goes through and cures PTSD. It cures depression. It's a physical living thing inside your body. And if you don't address it, it doesn't go anywhere. And so eventually I got to the point where I'm like, okay, let's do this. I'm like, what do I have to lose? I feel like crap every day. I don't want to feel like this anymore. So let's go see what you got to offer. And I jumped into the chair and received my first treatment. And I was absolutely blown away. I was blown away with the way that I felt because I hadn't felt that way in I don't even know how long. Maybe when I was a kid is the last time I felt that kind of joy and happiness that ketamine was able to unleash for me. And the way it worked was it essentially stripped away all that baggage I had been carrying around for so many years, and just let you feel what it's like to not carry that around. It's kind of like going on a hike, right? You're humping, doing a 10 miler, and you get done and you finally peel that pack off your back. That feeling, that's exactly what it felt like, but for your brain. And so, I instantly went on camera to share my experience of my first ketamine treatment. And then it was like maybe a week or so later, I came in for my second treatment. And that's when I really had this like epiphany and saying, you know what, this medicine here is really special. I want to be able to, tell more people about it. I want to help you out here at the clinic to really spread the word about this. And as we started digging into it, and really starting to spread the word and getting more people in there, the doctor and I partnered up and blew it up. We moved into a new facility and really started getting things going right before COVID hit, which was a struggle, but we were able to stay open through COVID. We're still open to this day. And I believe it's fueled on the mission of what we're doing. We're really here helping people every day. We're saving lives. And I talk to my staff about it quite regularly about, remember the reason why we're here. The treatment does get very monotonous with the same thing over and over again because it is so simple, the procedure that we are doing, but the impact that we're having is incredible, and you see it every day. And that's something that you're not going to see with giving them an antidepressant or an antidepressant drug. It's we hope this works, let us know in the next 4 to 6 weeks how you're feeling. With ketamine, it's instant. You'll feel it instantly. We have a treatment program that you'll feel like the longest relief after you completed that. But I mean, right after your first treatment, you're going to feel it. And so, like I said, I teamed up with the doc. We blew it up. We got into a new facility, got some new staff members in there. I've got a couple Marine veterans that work for me that understand, the demographic of who we're targeting with veterans. But really, it's good for anybody. It's so non-invasive. It's not going to hurt you. It would take a lot of ketamine to actually hurt you. And we practice with low dose ketamine. And like I said, the results have been incredible. I have people come in that this is their last chance. This is their last ditch effort to see if they're going to continue on with life or if they're going to take their life. And, we sit with them and we talk with them and we get them through their treatments. And, by the end of it, they're whistling Dixie as they're walking out of the clinic. So, that in itself is the reason why we keep going, is because we see the results every day, from veterans, from, first responders, from teenagers. So many people come through the clinic that have, are at their last leg, about to give up on life, and literally just receive a new lease on life because they remember what it feels like to have happiness and joy again. So kind of a longer story, but that's how I got involved in it, man. And I'm doing it every day. I talk with the guys at the clinic every day. And whenever I'm feeling, questioning why I'm working so dang hard, I just go and I sit with some patients and I remember, like, this is exactly why I'm here every day.
So it sounds like you guys are kind of doing also peer support in a sense. Are you guys connected with the VA as far as with like peer support specialist or anything like that? Or since it's such a new treatment, is it not, is the VA not pushing for some of these people that might need to get some?
Let me add to that question, but it's more of a clear one.
Yeah.
With the new VA Choice program, then they pushed as another thing. Now there are veterans that could be using other basic treatment elsewhere. Now we have programs that the VA doesn't see it, like oxygenation, or there's the ganglion block. And now we have what you're saying. Those are things that the VA is still not utilizing, but we've seen and through research and data that it does support it and help it. Now, how is the VA seeing you? And do they refer them? And are you guys like anywhere else in the nation?
So it's a lot of questions in one sentence. So let me see if I can tackle them all.
You gave us a lot. So
to answer the question on does the VA support ketamine? No. It's a funny, I put an asterisk next to that because I had a conversation with one of the docs there not too long ago, and he actually recommended ketamine, but they don't offer ketamine. They won't refer you out to a ketamine clinic. And the biggest reason is because the way that we're using ketamine is not FDA approved. It's off label. We're not doing anything that's wrong by any means, but the FDA doesn't recognize it as like the intention of why it was created, right?
So what's hard
Ketamine's
too
been
is
around
the
for like
studies,
60
right?
years.
So, I mean, you have people that have mental illnesses, but they say, hey, we want a long-term study. However, how do you look at the numbers of when someone doesn't commit suicide or have depression? You know, is it a 1 through 10? Here's my happiness level. And you know what I mean? It's not like the variance of like, okay, can you really quantify, did you help somebody not commit suicide? Well, you don't know because tomorrow's not here. So,
well, and here's the biggest kicker to the whole thing. And, you know, we can get political on this if we need to, but
I was about to ask
do
you the next
whatever.
one.
Yeah.
What is
yeah,
the
it's all
care.
political at this point.
It might be on YouTube, but Spotify is good too.
Why are we still like, you know, doing 5Ks for cancer? Right? Because there's no money in the cure.
Right.
And with the success rate that ketamine has, you know, we're toting a 75% success rate with ketamine. That means 3 out of 4 people are going to experience relief from depression, anxiety, PTSD just from doing the treatments. And it's non-invasive. It's not going to hurt you. But the problem with it is you don't have to do ketamine forever. Eventually, you'll get to a point where you don't need the medicine anymore because your brain's healed. There's no money in that. You know, the pharmaceutical industry and SSRIs, antidepressants, those are, you know, they're making them so much money with the success rate being like, I don't know, below 10%. I don't even know what it is. It's so low. And everything is like, you know, hey, let's try this. If this doesn't work after, you know, a couple months, then we'll try this. And it's a guessing game, you know, whereas ketamine's pretty definitive. You're going to know if it worked or not.
Yeah. Do you want to work your way out of the job? It's just like the homeless situation. It's the same thing. You know, people are getting money to solve this problem, but why would you solve it?
If they solve the problem, then the money stops, right?
Going back to the political thing that you were saying, is there any currently right now legislators, and by legislator I mean representatives, congressmen, senators that are looking into this research or has pushed anything regarding that to higher echelon?
Not that I'm aware of. Okay. I'm involved in a few different groups, and I talk with a few different groups that are pushing this, just psychedelics in general. And so ketamine being legal, you know, and it's like I said, there's so many, you know, lines that have to be crossed with ketamine in order for it to become mainstream. One of the biggest things is it's open market. So they can't patent ketamine. You can't patent, you know, the formula of ketamine is like aspirin. And so it's just like, there's just not a ton of money in ketamine. And so there's not a lot of push for it. They've done a few things with what they call S-ketamine or Spravato, which is like a nasal spray, which you can get through your insurance. Whereas what we do is way more effective than what the Spravato is, but it's just not FDA approved. So insurance doesn't cover it. That's why the VA won't cover it. And again, it's effective. And so that's why, you know, they're not giving us that, you know, green light to get it out there to everybody, you know, and it's so available and it's so cheap. You know, we're giving out ketamine cheapest in the nation as far as I'm concerned, and with the quickest results. There's a lot of different methods that they do it. They can do it through an IV process. We do an intermuscular process, which allows you to have more ketamine in one treatment session, versus taking an IV where it's slowly dripping into you over one treatment session. So, you know, we feel like what we're doing is kind of setting that footprint for all other ketamine clinics to emulate. The doc has even written a book about a stepping process of how we are able to get you up to your target dose in a timely manner so that you can get that, what he calls the holy grail of relief, which is no medicine for 90 days with no depression or anxiety symptoms. Everybody's different. Everybody's brain's going to require different dosage, but once we dial in whatever that dose is, then that relief starts happening, you know, and it continues on for like I said, 90 days. Now there are some people that are, you know, veterans of the clinic that are getting 4 to 6 months of relief before they even come in to see us again. And sometimes those guys are even coming in just as maintenance, not even,
those are
not really experiencing like a ton of symptoms, but you know, I want to just continue, you know, on this trek. So they'll come in, they'll get a booster, and then they're good for another, you know, 4 to 6 months, which is amazing.
Do you guys collaborate with other clinics throughout the nation to help veterans or support them?
Yes and no. It is still a business. You know what I mean? In my mind, in my opinion, I don't feel like I'm in competition with anybody because I really am in the business of spreading the word of ketamine and getting people aware of the results of ketamine by any means possible. So I don't feel like I'm in competition with any ketamine clinics, but a lot of it, like I said, is still business. So they're not really wanting to collaborate with each other. Some companies, like I do have a company out here that offers, other methods of treatment outside of ketamine. They do provide ketamine as well, but they also do like psychedelic assisted therapy, which I don't have that resource in my clinic, so I'm more than happy to send them over to that clinic to do the therapy portion of it. And I encourage anybody, they're not finding that comfortable spot at my clinic, to definitely I'll send you to any other clinic out there, because at the end of the day it comes down to the medicine. If I can get you in the medicine and you start seeing the relief, the people around you start seeing the relief, they're going to start asking questions. What are you doing differently? And it's just going to continue to spread the word of ketamine. Now, to answer your question, am I in multiple locations? I just have one location here in Utah, with the goal of creating a nationwide clinic. There's a lot of red tape and a lot of changing of laws since before COVID, during COVID, and now that we're post COVID. Some of those laws keep changing, so it's been a tricky situation to really nail down what
Postdoc.
the
Yeah.
what's legal and what's not as
Mhm.
far as medicine is concerned, because at the end of the day it's still considered a medical clinic, and so we have to follow all those rules. But my goal is to eventually be in every state, and if not being like an in-house inpatient clinic, but a virtual clinic, to where we can educate and actually send out the medicine to you at your home and
That'd be
allow you
great.
to do it
That was a
at your
question.
house.
Yeah, I think that as it's getting into the culture, I mean, Netflix and there's other documentaries that are talking about, psilocybin and other type of psychedelics. And in the history, you talked about the stigmatism and why that stigmatism kind of came to play. You know what I mean? And it could very well be some of these pharmaceutical companies and things like that are pushing out the opiates and that whole opiate crisis. But I think also to politicians, I call it chicken shit leadership. Who is going to really put themselves out there to say, uh, this is really good when it's such a new cutting edge kind of treatment. But I think like what you're doing, as it starts to really saturate in that area and it starts to spread out, I don't think they're going to be able to deny this anymore. When the truth is there and people are getting help, I think you might have some more people willing to kind of go about it. But the trick is doing it without breaking a stigmatism. Or another question I had, like psychosis and, schizophrenia, when you guys have a patient come into your clinic, is there a method, to say, hey, you might be that 1 out of 100 that might, have a bad trip or a bad, instead of seeing heaven, now you're in a hell situation, or you're not ready for it. Do you guys kind of give them a little bit of like, hey, here's some of the experiences and we're here with you?
Absolutely, man. Absolutely. So, kind of a loaded question. So let's see if we can break it down. So every patient goes through a consultation with a practitioner, a nurse practitioner, or the doctor, just to make sure that this is going to be an effective method for treatment. There are certain stressed out brains that it's just not going to benefit you. Bipolar, schizophrenia, stuff like
Mhm.
that. Um, Probably not going to be the best, method for treatment. Not saying that it's not going to be a method, but it's probably not going to be the best. I'm not a medical guy, so I'm not going to sit here and say, oh, well, if you have this, then cool. If you have
Right.
this, then not. Everybody's different. Sometimes it's based on medication you're taking. Sometimes it's based on maybe you have blood pressure issues or liver
Right.
issues or whatever it is.
Yep.
So, everybody goes through that screening process. And we do offer those consultations for free. I don't want it to ever be like, well, I don't have the, $50 or $100 to just even sit down to find out if this is worth it. We offer those consultations for free. And once you get, screened through the process, we determine that this is going to be a good treatment for you. We do explain to you the side effects of the ketamine, because ketamine is similar to, LSD, psilocybin mushrooms, MDMA, to where it's going to go into your brain and you're going to have a psychedelic experience. Really, that's a side effect. It's not
Mhm.
really the healing modality, even though on opinion based, I believe that a lot of the psychedelia, controls a lot of the healing because it allows you to see things in a different light. The way our clinic's set up is give you a safe environment to have that psychedelic experience. And it's really the aftermath of the ketamine is where the healing occurs.
And in what realm or in what placement would you put THC on that one?
As far as like a psychedelic,
Um,
it's
Like,
more of a psychoactive versus a
okay.
psychedelic. I'm a huge proponent of I definitely support cannabis and all of the healing, that it does provide, not only for mental health, but for physical health. It helps rejuvenate cells. I've seen, full spectrum, they call RSO,
detox.
that,
I'll bring it in. My bad.
that actually cures the cancer and stuff like that. So I definitely believe that, the combination is a good thing. Again, consult with your doctor first. I'm not a
Yeah.
doctor, you know what I mean? But to answer your question about, bad trips, definitely a possibility with any psychedelic that you're going to have a bad trip. A lot of people will say, well, it's all about where your mind was before you started, and that's
Yeah.
will determine your trip.
Right.
Well, I'm
Mhm.
dealing with people that minds aren't in a good
Right.
place, right? And so I actually encourage a bad trip in my clinic. We call it just an adverse reaction, or immersed reaction. And the cool thing about ketamine versus the other psychedelics that are out there is the half-life of ketamine is only 30 minutes, right? And so
Yeah,
if
where
you
the
do
other
have a bad
hours.
trip, it's only going to last for maybe 10, 15 minutes. And most of the time, you're not even going to remember it. Our staff is trained to help coach you through it while you're in that, bad trip. But for the most part, we look at it as a healing side because you are identifying some, pissed off neurons in your brain,
Mhm.
some bad experiences that are stored into your brain, and we're tapping back into those.
Right.
And we're reconnecting the neuron to the left and right side of your brain. And so that way, that feeling that you're experiencing in the clinic when you're having a bad trip, man, it's going to be intense. But next time when you're out and about and you get triggered by something, whatever that trigger may be, you might feel it for a minute and then it goes away. Whereas, previously you're going to feel it and it's going to stay. And it could last for, an hour. It could last for a day. It could last for a week. And you never know, when something triggers you, how it's going to affect you, especially when that neuron's not attached to the other side of your brain, so you're just going to constantly feel it. Ketamine helps reattach that. And so it's, we think bad trip is a good thing, and we have people trained to help you through them.
Is so what you're talking about is the treatment while it's happening, while you get the appropriate dosage, the treatment and such. What's post-op?
What do you mean? What's post-op?
Like after
Peer
you said that,
counseling or anything
yeah,
like
do
that.
they have anything that you refer them, any resources? If you say like, hey, if you have I don't know, something on the site, consult with so and so, or you know what I
THC
mean,
buddy.
Absolutely.
or
So,
follow up in 3 weeks, 4 weeks, a month. Like
right.
I'm just asking, what's the
So I can kind of give you the breakdown of how that works.
Mhm.
So the treatment series is 6 treatments, right? And each treatment you'll come in and we'll give you 2 injections, 30 minutes apart. So you have your first one, you'll go, it works as a bell curve. So you'll experience your psychedelia and then it comes back down. And then once you're back down, you're back coherent. We check in with you, make sure everything's good, and then we give you your next dose. Once you get to your 6th treatment, we'll actually give you 3 injections versus the 2. And then at that point, we start measuring the interval. We do work with a company called Osmind, which is a bunch of different colleges, but I think it's more focused out of Stanford University, that tracks your mood every day. And so it sends you a text message every day. You can go on there and say, rate your feelings from 1 to 10.
Get the
And then
data
it gives you a
collection.
little place to journal if you want to put in there, hey, this happened, or this is probably why I feel this way, or whatever the case may be. And then our practitioners monitor that on a daily basis. So if we ever see somebody that is, dropping in their numbers and it's showing that like they're trending down, we can reach out to them and say, hey, what's going on? How are you feeling? Is it appropriate to come in and have another treatment? We call those boosters. So post, getting through your 6 treatments, we're at that point measuring your interval. We do have a couple different therapists that are experienced with psychedelic therapy to refer you to if that's, you know, the method that you want to go with. A lot of times it's tricky because, you know, I could send you back to your normal therapist, but your therapist might not be educated on ketamine, or they might have that stigma around ketamine. So then they don't know how to work with somebody that went from, hey, you know, you were going to kill yourself yesterday, and now today you're you know, talking about the future. You know, they don't know how to really deal with that. A lot of, you know, and I'm going to add my personal opinion on this, but a lot of therapists want to keep you as their client. So if I'm giving them something that's going to cure them and not need your services anymore, they're not really about that, you know. So, but we do have a couple, like I said, really good therapists that we recommend them to. There's a group every Monday that's a virtual group, and it's super cheap. It's like $50 a session, and it's you know, taught by this gal that does, you know, psychedelic assisted therapy. She's worked with several people that have gone through ketamine treatments, have gone through other psychedelic treatments, and, you know, talk about what their experience is in this rapid change from, you know, being really down and out to actually, you know, having this new lease on life and how to deal with it and how to move forward. Now, my personal 2 cents on what to do after your treatment. You know, you're going to be a little loopy after your treatment, so, you know, I encourage you to get some rest, hydrate, eat some good food. The next day, though, that's when you need to go out there and start, you know, firing off those good chemicals that are in your brain. And so I say, do something that you enjoy, do something that you would normally bring you happiness, you know, whether that's walking your dog, playing with your kids, going on a hike, you know, go and, you know, race cars, whatever it is that you do. Because now you're going to experience that with all of your receptors wide open and not bogged down with the stress and depression that you were carrying the day before. And the more that you go and do those natural things that bring you joy and happiness, the more your brain's going to remember to do those things more regularly, because you're going to feel them, I feel, at a higher, you know, caliber than you would have if you would have done it without ketamine the day before. And so that would be my personal touch on, hey, this is what you should do. But again, everybody's different. Everybody's dealing with their own shit. Now, I will say this, one thing that won't help you, no matter how effective ketamine is if you go right back to your old stuff. If you go back to, you know, your bad relationship, or you go back and pick up the bottle again, or you go back and you know, things that cause you normal stress and depression in your life, if you go right back to that same mentality or that same lifestyle, no drug is going to save you. No medicine, no healing modality is going to save you if you don't choose to make the change.
I think
Have you
there's a
guys
lot.
ever, sorry, have you ever thought about, and you guys probably already have, in the future, as this grows, funding comes, and you guys have such a beautiful place out there in Utah, having like almost like a ketamine camp, a couple of days, you know, where it's like you get your treatment and then you got the hikes. It's like a 3-day camp, 2-day camp, kind of to teach some of those life lessons or life hacks. You know what I mean? Get up in the morning, get sunlight in your eyes right away, eat a good breakfast, work out, you know what I mean? And those kind of things, and having more of like a social gathering, bonfire or whatever, you know what I mean? Have you guys ever thought about something like that in the future?
Absolutely. And I've talked to several people about it. It's really just putting the pieces together and doing it. I would say instead of a 2-3 day thing, I'd probably make it a 2-week thing,
Oh, wow.
you know, and allow you the opportunity to go through your whole treatment series in that 2 weeks, while integrating with, you know, these new things that can bring you joy and happiness, right? New healing methods, teaching you maybe yoga, or maybe learn how to play a few chords on the guitar, or, you know, painting pictures, or just going on a nature hike,
Archery
whatever
or
it is,
hunting or
you
something.
know what I mean? To where it's like you're focused in for the next 2 weeks, you know, no more distraction. Let's just recharge your life while clearing your brain, right? And then teaching you these new skills, so that way when you reintegrate back into your normal life, you have all these skills and a fresh brain to do it with.
It's hard to go back to your status quo when you go take this treatment. Obviously, everyone goes out on a limb because most people are not believers of your treatment and such. What do you have, or do you guys have some type of like research based information that you can give to the person in order to give to their provider in order to support some of what you guys are doing? The reason I ask this is because when they go do that, they have to present, or they've talked to their psychologist or their treatment people about this. If they don't talk to them about it, it's still treatment that they're lacking for the knowledge of that psychologist. Now I get it that the big proponent of like, hey, um, we want to push these SSRIs or something instead of what you're doing. It doesn't matter. Whatever the veteran's going to do is going to do. If they're going to want to drink and that's their treatment, that's what they're going to make it. If it's going to be psychedelics, ketamine, whatever it is, you can't persuade it until you change it. So if the psychologist see this, they can tamper their treatment a little bit more. It might be that at one point or another, SSRIs that might be taking could be contraindicated with certain medications or whatever they're doing, alcohol or something, right? So to get them knowledgeable of what's happening, do you guys have something or like some authors or some research that you guys give?
Absolutely. So we do have research, and then you got to remember that this research is not based in the United States. You know what I mean? Ketamine's been known to do this for the last 20 years, right? Why is nobody talking about this, right? And psychiatry is a big problem with that. Psychiatrists are paid by pharmaceutical companies to recommend their pharmaceutical medicine, right? And so it's really hard to, even with the research, to show, or to prove to these psychiatrists that this is a healing method that's actually effective, because they don't get paid by ketamine to do it. Like I said, ketamine's open market, and so no pharmaceutical company is going to be able to promote ketamine in a way that's going to profit them, and so that's why they don't do it.
I look at it like tobacco and marijuana. Like, how long did it take for people to really in the culture say tobacco's not good? Now nobody really smokes cigarettes. And then marijuana took a long time when everybody knew it was okay. You know what I mean? We had a 60s movement of peace, and I think politically people were like, oh, I don't like that. I mean, I'm active duty military, but I mean, it's an organization, right? We talk about the military as a company. It's an organization, and pharmaceuticals even bigger. You know what I mean? If you don't think that the pharmaceutical companies don't have interest, especially when something like you said, ketamine being an open source where anybody can make it, it's not, it's not closed source, it's not got proprietorship. Like, I mean, do you really want to open up that door and have a bunch of different companies and chemists and people making it? And you know what I mean? Now when you have your little isolated stuff, makes sense.
Right. Well, and ketamine's used in so many different things. We're using it off label, and so ketamine is probably in every ambulance. Used in the ER. It's used at veterinary clinics. It's a sedative. It helps calm people down. Like if you got in a really bad car accident, they would give you a pretty big dose of ketamine to calm you down.
It's a horse dewormer.
Well, my first encounter with ketamine is when one of these amazing doctors that I know, he started saying, nah, fuck that. We're not using morphine anymore. We're using ketamine. And he started just pushing so much ketamine when our guys got their legs blown out and all that. And he was teaching us like, listen, this is non-addictive. I can push so much more of this and not get the same reaction. So that was my first positive reinforcement of ketamine. And, actually we've never talked about it since today, and you mentioned Stanford. Is there anything that they've brought in or any research available that they can converse, or you guys have tangible in order to,
That's what this is all about.
Okay.
How long we're the pioneers of this. Ketamine SLC is the oldest clinic in Utah. And so we get hit up by a lot of these other companies and research groups to look at our stats, because we've treated over 3,000 people in our clinic. So we probably have the best stats of anybody in the nation. There's clinics in all sorts of states: California, Florida, New York. They're all over the place, but not the volume that we've done, because we've been doing it for quite a few years now. So we are building that research, and the more people that participate in that, using that free application through, it's called Osmind, that helps build those stats, and we can see how effective it is. If somebody starts off at a 1 and they end at a 10, something's happening, and then we start measuring the interval of it. So we're well on our way with the research. We're not doing the research ourselves, but we've got people from Stanford that are, and they're teamed up with other groups that are doing it. I could pull them up and tell you all the different people that they're involved with, but it's definitely creating a movement, just like marijuana did. Eventually it'll get to that point where enough people know about it, so that way it's not an issue of, big pharma says no. It's more of a, the people are saying yes. Now, with that component on there, they are starting to stick it to us already with making it difficult to get ketamine for what we're using it for. Like I said, ketamine's open markets and there's plenty of it, but they can restrict on who's able to buy it. And so we've experienced that challenge several times in the clinic where we've had to change distributors of where we get our medicine at, because, they say, well, they changed the laws, so now we have to do it this way, or, whatever the case may be. But we're still being able to find it and source it and stock it. And the more that we do that, the more people use the app, the more research we have and bigger case that we can make. Like I said, we're at the forefront of it.
So is it getting harder for those sub vendors to be able to maintain the requirements that they're
Wait, let
putting
me
on
stop
the
you there.
laws?
Let me stop you there. Let me stop you there. Have you talked to any of your representatives or any of the legislation and yourself? Like I know that you're saying that it's part of a, kind of like a niche for them that they make money or whatnot. But have you personally went to your representative, congressman or senator, to say, hey, I got something here? Or do you guys have in your company or your people someone that went to some of them?
We don't personally, like I say, we're involved with groups that do that,
Mhm.
that are doing, the campaigning and lobbying with, people of higher power. I know my pay grade, you know what I mean? I'm not going to try to go up there and be the, the legal guy for it all. That's not my position here. I'm a guy who suffered, who got relief, and I wanted to continue, this fight for them and connecting with the right people to do those things, to go talk to the powers that be,
Oh, yeah, I entice you, I encourage you, I push you forward to do that and go talk to these representatives of yours, because there is no one more of a proponent or an advocate for veterans than you right now. Because as you're doing this, on the other side of the table, the person that's going to receive you might be a veteran, might be someone that's dealing with it, might be someone that's lost some friends to it. I'm telling you, because I was that guy, and I was able to change law myself for veterans when I was with Senator McCain. I didn't do it myself personally. They said Senator McCain did it perfect, but we were that big catalyst to do it. So I know I keep, going to it and all that stuff, but it's something that I think that
You
if
have the
you guys are
experience, right?
pushing it
In
and you
Congress,
guys
right?
have a university behind it and you guys have all this data that contradicts what status quo is, and you can make a change to it. I mean, how can I help? That's how I feel, and I'm just listening to it. Imagine those congressmen, those senators, to use their rhetoric to saying like, "This is the new change that we're bringing. That's why you need to vote for me." To play on that and all that stuff. It doesn't matter if it's red or blue to me. It matters who wants to push the mission, who
Yeah.
wants to be that
Yeah.
non fucking what Gunny said earlier. So
Not, yeah.
yeah. So
Taking shit.
I exhort you to go there and say like, hey, can we set up a meeting with your veteran advocate, and then go from there. If you need me to, I can go into the Utah representatives, find them for you, get you their emails.
Yeah,
So
Because
let's
the wheel
definitely
gets the grease.
touch base offline and
I
see
can
what we
do
can
that
do in
for you.
that.
Yeah, absolutely. If that's what I can do to help you out and help your mission, then that's the least I could do. Why not? I'll give my 10 minutes of my time to get you that info.
And this is what
Perfect,
it's
man. I
all
appreciate
about,
that.
man. It's like all these people that we're trying to get on MVP and become of this community that has all these different people that they influence, their circle and skills, you know what I mean? And that's what it's all about, because you don't know, like, and then you get in the door, you can find somebody that's all about it, that wants to champion this. And then all of a sudden now it's a lot easier for you guys over there at the clinic. You know what I mean? Or even the sub vendors. Like
It
trust me,
fucks
I
with the sub
understand that
vendors.
shit.
Legislation fucks with the sub vendors. That's why they can't get their shit. And like sub vendors
Mm-hmm.
can't do shit about it.
Bro, I
They just
worked
have
for
to
the
follow
Defense
along.
Logistics Agency, man, and
Yeah.
that was it. It was getting half of mom and pop shops that no longer make this stuff because we stopped ordering it. You know what I mean? And then how do you get it? And that really is, what capitalism is trying to get these people to be able to make it, and it's part of our economy. You know what I mean? And if we have to fix that supply chain, you know what I mean? And if that's going to be a problem, those are the constraints. Like we push this and and you get a massive inflow and you get all these people through MVP that want to come, and you get enough ketamine, I mean, that's a constraint, right?
Yeah.
And we have to find out how to solve that. You know what
And
I mean?
I'm sure this is not the first time you heard it or anything like that. This is not going to take a week or 2 weeks to get fixed. If so happens that to find the congressman or a senator that's going to champion whatever it is, right? So let's say we have a veteran in Philadelphia that heard about your program. How can they go to, get support from y'all? Is there a possibility or an opportunity?
So, I mean, we have several people that travel from out of state, here to get treatment. And so, it's not a program that we have, in place that helps them with the transportation of it. But, definitely there's, we do have people coming in from out of state to receive treatment at our clinic. They have the opportunity to get treated, in the states that they're at, but they've heard about us and they know, how we do it at our clinic. And so they make the trip down. We've had people come from New York, Canada, California. I mean, you name it. We've had people travel to us to receive the treatment that we offer.
Okay. So once they get there, they have to get their hotel room, pay for for your services, and what's the overall on an average that would cost this to a veteran?
So veterans, we give everything's 50% off. So they're looking at for the total treatment, and then continuing on with the boosters. Let's do some quick math.
Oh, you can do ballpark because everyone, if let's say someone comes from Florida, it's going to be different from New Mexico.
So I think the full
You know
treatment
what I
was
mean?
what, $1,900 or something like
Yeah,
that.
so it's $1,900. So you're looking at like $950 as a veteran to be able to come in and get the treatment done. But that's $150 per treatment, right? So that's like
$1,000 per treatment.
that barely covers the overhead of what it probably doesn't even cover the overhead. Who am I kidding? We're a volume based business. You know what I mean? Because it doesn't cost us a lot of money in medicine, but it does cost us a lot of money in staff. Because the people that I have there are, they're doctors, they're
Doctors.
nurses.
Yeah, they
You know
have
what I mean?
degrees. Yeah.
Right. And so, we've definitely got to pay them, but I don't want money to be, the deciding factor of whether or not you're going to get treated, so, for veterans, first responders, we do give it to them half off. And even at full price at $300, it's still, we're scraping by with, even at $300, cause you're going to be in the clinic for at least 2 hours. You know what I mean? But I do have several rooms. And so, as long as we're continuing with the volume of it, the price point will never change. It's, as supplies go up, cost of labor goes up, all that stuff, we've got to accommodate to it. But if we can continue to spread the word and continue to keep that revolving door going at the clinic, we'll be able to maintain that prices. But to answer your question, it's around $950 for a veteran to get through the entire series. And then it's just $150 every 3 months if you need it. It's there for you. We do have different finance programs. You can do like a 90-day interest-free program. We do accept like HSA and stuff like that. We don't do insurance because insurance doesn't cover it. Mm-hmm. And I think that's probably the biggest reason why, the VA doesn't recommend us, because they have no way of paying for it. TRICARE, TriWest, or whatever it is that the VA uses won't pay for it because it's not accepted through the FDA and covered by insurance.
Now, are you guys still doing a ketamine fund or some kind of philanthropy or a way of helping out with that too? And if not, because I think it was before a long time ago, maybe we can push out some people that want to donate and do some things for it.
Or do you guys work with other nonprofits or some organizations that help mitigate the veterans
Cost.
cost? Absolutely.
Yeah, that's definitely something I want to get more involved with either setting up a nonprofit myself or just teaming up with one. I'd rather probably at this point team up with one instead of trying to take another bite of that huge pie that I've been trying to chew on. Having a place that I can send donors to, because I do get donors quite often. People come and saying, hey, this saved my life. It saved my kid's life. I want to give back. How can I give back? Now, being a for-profit company, I can't accept their money. When we were working with Ketamine Fund, we did have a resource to send that money to. That money isn't guaranteed to come to us though. And so there's, that's a whole nother story there, but
yeah, that's
what they're doing is great. They're nationwide. I don't know. I haven't followed up with them in quite some time now, but What they were doing, what the pilot program that we launched through our clinic is, had a goal to treat 400 veterans for free. And, we tracked the statistics on them and had some really good numbers come out of them. And that's the numbers that Osmind based, the beginning of their research off of. So that was really cool to have those numbers to present to them, because as a part of that pilot program, you were required to, report to us how you're doing. And that's what allowed them to have that treatment for free. So that one gave us the best statistics because it was consistent. Now that we are teamed up with Osmind and can offer this, tracking mood, we call it a mood monitor, to anybody that comes in the clinic, it's able to build better stats and help build that, that platform for everybody else to see that this is a working healing modality.
I think Doc's mindset too was asking, and part of the cost was the logistics piece of it too. Like with MVP, Doc does so much where he knows people in different states and places. And when we have an event, he's able to, set up a place for them to stay and all those kind of things with veterans to veteran help. And I think if we're putting people through out of state, we could definitely, if this is something for those people, I can't say yes or no, but if it is, logistically, maybe we and MVP can help make that a possibility and lessen the burden of the money. Not to mention Doc having a nonprofit himself, we could start looking at that. I know we're going to try to grow MVP and get some grant money and stuff. And this could be a big proponent of it and getting help and then showing it. So I think it would be a good feeder to send to your clinic for some of these guys.
Yeah, definitely. I mean, I'd be interested in, chatting with you further offline about, your nonprofit and, if I can direct donors to you, and use some of that money to help people get into the clinic to get treated, I'm 100% about it.
That's awesome.
Thanks, man. Yeah, absolutely. We're all about the one team, one fight proponent. And honestly, I base most of MVP on, and the way it started was the holistic approach, because I don't want people to think that my mentality or my prerogative is going to sway how medicine goes. And I'm not trying to promote here MVP, but the one thing that we all did before was fitness. So we start trying to work out a little bit more, change that brain chemistry that you spoke about, right? Because it is a good proponent of it. And then doing it together as a group to encourage one another. The virtual settings is basically because we're not here with one another as we want to, high five each other or nut tap each other. You know what I mean? But we're all here as a one family, whether you are a veteran or a supporter or you have an affiliation to the military, whatever it is. You could be a friend of a veteran. You can come in here because it's that one team, one fight. And you'd be surprised how many people of caliber we have in MVP on the DL. They're like, hey, doc, don't say I'm here, but I'm here. It's like, all right, my bad. Cool. We've been able to do things just that I would never think we'd be able to do. We were saving families from across the seas, and we're just sitting here in either California, Arizona, Texas. And you could see it into fruition just by tapping on someone's shoulder that's another vet or can hear the story. And that's what I want to be a proponent of, that this is you're the right person and there's no wrong door, but we can find a place if this is not the right place for you.
Well, and the great thing is vice versa too, for them that are receiving the treatment to say, you know what, here's an organization that every week they do a Salty Sailor talk. They do a peer-to-peer talk. They have a peer support specialist from the VA. It's a guided discussion. You know what I mean? We talk about things. It's not going anywhere else. It's all in-house. And then you become part of that organization where you do have somebody at all times to talk to. And then, you collaborate and you find out there's other charters and people out there that you can go and hang out with, whether it's playing cornhole or going hiking or whatever it is, and start to be that, you know what I mean? And that's what we're trying to do.
And let's say that MVP is not for you. Man, I got some people in the Semper Fi Fund, Wounded Warriors. They might be intrigued to talk to you. I might not be the biggest push for you, but I will be the biggest push for you because you're a vet and you want to help other people. Yep. That's it.
That's what's awesome about this.
I definitely want to chat with you some more, Doc. I said offline, kind of keep this topic more on the ketamine,
Absolutely.
while we're talking about it. But, I've got tons of ideas, tons of resources, based solely on what you guys are doing over there at MVP. You know what I mean? I know I'm one man, and I've got big dreams and big thoughts, and, really it's all geared around, what your guys' core value is there. It's one team, one fight. You're not in this shit alone, man. I really thought I was in this alone for a long time.
So to bring it back on the ketamine stuff, so I know from watching another interview that you've done, you're talking about a story of a young lady that was like 17 or a teenager that was able to get some treatment that saved her life. And I know it's not just for veterans, right? It's for everybody. This mental health issue that we have is not just veterans, and then we see it younger and younger. So can you share that story too?
Yeah, I won't dive into specific stories, but I can kind of give you a general. Think about it this way: when you're a veteran, you're suffering with PTSD, and you come home with it. Who's else is getting PTSD from it? Your spouse, your kids, your neighbor, your friends. They're experiencing what you've experienced, and everybody. I mean, PTSD is a traumatic event that happened in your life. A lot of the PTSD that we have probably didn't come from war. It probably came from our childhood, right? And so and then it compounds on it with all the other things that have happened. Kind of focusing around like different stories in the clinic. We had this one young man that came in. He was 14 years old, straight A student, played all the sports. He was just killing it. And then something happened and he changed. And he said that he started to hear voices and he started to, really have no desire to live anymore. And he was, the way his parents figured this out was they saw his grades dip. They saw him missing practice. They saw these things happening. This kid's like 14 years old. Like, what worries does a 14-year-old kid having? He doesn't have to pay a mortgage. He doesn't have to show up to work every day. What's really going on? And we got him in through treatments, and literally, I would say halfway through the treatments, they started to see the biggest changes in him. After he got through the entire series, he came back in for a booster, I want to say at 4 months, and he was killing it again. He was back, captain of the sports teams again, back to straight A's, looking forward to, which college do I want to go to, stuff like that. And this kid's 14 years old. So it's good for anybody. Everybody experiences some sort of trauma in their life. Everybody experiences some type of, depression in their life. The doctor will say, if you don't know if you have depression, take some ketamine. And if you're happy with it, then you probably have depression, right? And so it's, I guess I'm not the doctor of it, but I know everybody suffers. And, if you don't do anything about it, it's just going to get worse. And, I've seen, like I said, there's so many stories of people coming in that, like I said, they were on their last leg. I had this one guy come in from California that told me, like, the first day I noticed him, he was this little, skittish about being there, wasn't sure, this and that. So I just sat with him, talked to him. He says, I'm nervous, man. I don't know. I've never done psychedelic before. I don't know what to expect. I'm like, hey, man, I got you. Let's sit down. I'll sit here with you through your whole treatment for this whole hour that you're going to be here. Sat down with him, and he had some bad trip experiences and all of that. But at the end of it, he was feeling pretty good. And I said, are you going to come back, tomorrow and do your next treatment? And he says, yeah, I'll come back. Well, the next day came. His appointment time came. I didn't see the guy. I was just like, damn. So I call him, no answer. He came in the next day. And I was like, thank you for showing up, man. I missed you yesterday. And he told me that he was in this hotel room because he traveled here from California. And he had his gun. He put it to his head and he was going to end it all. He says, I felt better after the ketamine treatment, but I still can't get this feeling to go away that lives inside of me. And I promised you I'd be here and I didn't show up and I felt bad about it. And so I decided to come in today and give it one more shot. I said, hell yeah, let's do this, man. And sat down with him through another treatment. And next thing you know, he's coming back every other day and finished this whole treatment out and thanking me for, holding him accountable. I really feel that it's really that finicky with life. All it takes is that one person, counting on you, or you make that one little promise. It's even just as simple as giving somebody a smile at the end of the day, that gives them that one more minute of hope. And so that's really what I believe I'm in the business of is I deal hope. I don't deal ketamine, I deal hope.
So once a lot of people see this video, they're going to be like, how can I get a hold of you? How can I get a hold of Avila? How can we do that?
Yeah, definitely. So if, ketamineslc.com, you're going to be able to reach out to us at any time. We've got, different virtual platforms on there where somebody's going to be able to get you in for a consultation within, 24 hours. So reach out to us on our website, fill out just a little request. All it takes is a name and an email address, and we'll get in contact with you ASAP. I've got people in different states that work for me to help monitor those requests as they come through. So that way nobody's left there hanging, waiting, wondering, if this is going to be it, because it's really important for us to catch you at that moment of crisis and give you that little bit of hope and get you in.
Let's say we have a hard charger says, hey, I want that yesterday. I'm calling right now. What is the turnaround time for once he gets there or anything to get seen?
And that's an open question, because, typically I can get you in the same day. Typically I can get your consultation and treatment in the same day. There's preparation that goes into doing the ketamine, with what to eat, what to drink, stuff like that prior to receiving the treatment. And so, it might be the next day, but I won't deny anybody treatment. You come, you call me, we check you out. Everything's, cleared on your consultation. I would say our success rate from consultation to treatment is probably around 85%. The other, 15% that doesn't make it's mostly revolving around either cost or transportation. Other than that, it's, everybody, if there's a will, there's a way, and a lot of times this is their last ditch effort. So, they're going to find a way, and we're going to make a room available for you to receive that treatment. We're open 6 days a week, Monday through Saturday. When we've also opened up on Sundays when we did have overflow, just to get these people their treatment. So it's important to us that you come in and get treated and make that process as easy as possible, and it's not a process of like, I know a lot of people with the experience with like going through, pain management or getting certain medications from, clinics or VAs, stuff like that. They have to like prove their point, like I am really messed up. I really need this, and, really play it out. Like that's not what we're about. We're going to ask you the medical questions to make sure that you're, not going to get, physically hurt from the medicine, even though it's super non-invasive. Some people have certain medical things that just the ketamine's not going to work. It's not like we're going to turn you away. We're going to refer you to your primary care to let them know this is what's going to happen. Are they giving you the thumbs up for your physical body? And then we get you in right away. So, we make the process super simple. Consultations usually don't last more than 30 minutes. It's mostly based on, we'll ask you maybe 5 minutes worth of medical questions, and then spend the rest of the time answering your questions, and then get you in right away. We want to make sure you feel comfortable with going into the treatment and, dedicated to finishing it. That's the biggest part. Is sometimes the first couple treatments, you're going to think that, you're not feeling any better. People around you'll probably notice, but you won't. But it's all about sticking through it, get through the treatments, because once you receive that 6th dose, you're pretty much set for the rest of your time through ketamine. That's the dose you'll receive, every 3 months, 6 months, whatever your case may be, until you don't need it anymore.
Yeah, I think the biggest thing
is to have that long interval to where you don't have to come see us. It's not a very good business plan, but it's a good life plan, and that's what we're about.
Yeah, it's like perfect timing too. I know with the UFC and things happening with Patty Pimblett talking about the stigmatism, as men, we're not, for some reason, we feel that we can't share the load that we have on our backs. And I think the biggest thing to, is one, try to get help.
Right.
Say, hey, I need help.
Let me quote on that real quick. So it's, the stigma is out there, like men can't talk, right? Well, here's the beautiful thing about ketamine. You don't have to talk. There ain't nothing to talk about, man. You just go and let's feel the feelings, and let's address them, through your brain. And afterwards, you'll feel more comfortable to talk about it.
That's perfect.
Doc can probably quote on this. Like, you guys are familiar with the EMDR? Or, so
eye movement.
with the EMDR, you've got to focus in on that traumatic event in order for it to fire off that neuron, and then it does the light movement, so that way you can start reconnecting left and right side of the brain. With ketamine, it's just going to go find that fractured neuron in your brain, and it's going to start reattaching it. So you don't have to sit there and think about it, because nobody wants to think about it. So I think I got worse in therapy, going through the VA, going through therapy, cognitive therapy, because I don't want to talk about it. I don't want to sit there. I don't even want to think about it. Yeah, I'm pissed off, but I don't know why. Try to narrow it down to a specific event or a specific, thing that happened in my life. I don't know. I don't even know why I feel this way. I can try to make up something in my mind of maybe that's what it was. And then, maybe I leave there better. Maybe I leave there worse. With ketamine, you don't have to talk about it. Ketamine's going to, will give you a nice, quiet, comfortable place to go and address your issues, on steroids pretty much. We're going to give it to you. And so you can address it huge and not have to really talk about it, like I said.
I think we have this big image or what we do. Like, I mean, think about the Marines. What was the Marines founded? Where were they born?
At a bar, yeah.
In a tavern, right? So a lot of us, to let go of some of that stuff, we need something to give us off that edge. Then we go to alcohol. Why? Because it's legal. Because the best times that you had was probably in a bar. So everyone goes, have a good time at a bar and all that, and they go back to say
stigma associated with that too is like, hey, this is how men solve their problems. We get together and drink.
And then, the biggest thing with drinking is that it's one of the biggest leads and proponents of depression. And a lot of my friends that actually took their life, they were drinking beforehand. Some of them that tried and the pin didn't go off or something happened. When they woke up, they're like, I was blacked out drinking.
I think you bring in a good point too, because it's multidimensional suicide. Yeah. It's not just PTSD; it's depression, anxiety, medically bipolar, whatever it could be, right? Genetically, so it's not just a one
size
fits all.
It's just a bad day.
Yeah.
You just had a bad day. You can't, you lost all hope and like everything's going freaking wrong. I could just be done with this. I don't want to deal with this anymore. And, you add alcohol into that. Now your decision making is going to be poor. And you're going to wake up.
How hard is it to tell someone, hey, don't drink anymore? They're like, why the fuck not? That makes me feel happy. Why should I not drink? So then they see you as the enemy. So it's hard for me to tell.
I take away my happiness.
Yeah. So it's hard for me to see people or people to see me as hey, he's trying to help, but he's trying to take what makes me happy. So a lot of things that we try to promote is moderation. But as you are saying, this could be the end all be all. It's just even more amazing,
The thing I think too that you touched.
Oh, go ahead.
Yeah, go ahead.
I was saying I've had veterans come into the clinic, and like I said, the best part of the day is when you wheel a patient out. We wheel them out to their ride and ask them about, what's going on in their lives. But I've had so many veterans come in saying, I've been drinking every day. I drink a fifth, this and that every night. And ever since I started doing ketamine, I haven't even had the desire to drink.
Right. It's those small decisions. And I think that's what you were talking about earlier is like, yeah, you have a friend, you have counseling, you have ketamine. It doesn't mean that some of the problems in your life don't go away, but however, it gives you an outlook and some more motivation. Same thing with a buddy that you're talking to can give you that pep in the step to say, hey, I'm going to make a right decision. Hey, I'm going to work out tomorrow. Well, things can happen where you won't, but if you fucking fold your clothes and you have your shoes right next to your bed, it's so much fucking easier to get up and be like, there's no more excuses. So how do we teach people to set up their lives in a way, not only to bring them happiness, but that are going to make those decisions that they can climb themselves out of that depressive state and make things better, but it's not going to happen right away. And I think that's why a lot of the peer support, the Salty Sailor talks, those other things, that part of that community where you can have outside of the chain of command, mentorship as brothers around an area that you can really look to. And it's going to be the veterans, Doc, you said veterans we got to take care of our own and we got to do it. It's not going to be the VA. It's not going to be the fucking politicians, right? It's going to be us. It's going to be, hey, big dog, you're doing some weird shit. Let's come over here. Let's talk.
Well, and I think it's going to help, strengthen, the nation as a whole when they see, this is one of my biggest things that pisses me off about the veteran community is that they look at veterans as if they're like some kind of charity case, that they're some type of broken human being, that they're not that badass. I was out there kicking in fucking doors. Like you're still that person. You're still that badass. You're still the American hero. The problem is we victimize veterans to think that they're all fucked up and they need free fucking chilies. Like, no, they don't. Yeah. What they need to do is get their head right to be back into society as that role model, as somebody to be looking up to, because even though you're putting them into that victim mindset or that, victim category, people still honor your service. People still look at you at a higher level because you've done what you've done, regardless of what they're doing. I deal with that every day. Like, oh man, you're a Marine. I don't look at it that way. Like I did my service to my country, but everybody else looks at me like I'm something special. Right. So why don't we change it from them being such a victim to still being that someone special?
An advocate.
And how do we do that? Let's get their mind right Let's get them back into the swing of things, back when they were firing on all cylinders, when they did have their beds made in the morning, when they did have their PT clothes ready to go.
Yeah, sure. Yeah.
You know what I mean? Like, and now you're showing like all these successful veterans versus all of these homeless, depressed, alcoholic veterans that just need, a free meal and
it's hard to be that apex guy, that elite person that when you're pushing, everyone sees you that way, but you don't see yourself that way because of your physical fitness, because you've been drinking too much or something like that. Sometimes it takes one of us three with this caliber that we have to say like, yo, I do it too, but let's stop that because I used to do it and it won't take you anywhere. Let's go. Where? Let's just fucking go. Let's go.
Yeah.
Whatever
Your
it is.
treatment yourself is through
even if you
service,
take them
right?
to and man, I commend you so much for doing what you're doing with the service that you're doing post your military service. Like a lot of us keep doing it and you don't hear it enough, but man, thank you for what you do. Seriously.
Yeah, thank you.
Thank you, Doc.
Yeah. That's awesome. Well, we could wrap this up, and I just want to tell everybody and the viewers and listeners, this is a big thing on timing. You need to call out to your brothers and sisters and make sure everyone's good. And I know that can be sometimes really hard to do too, is to say to your friend, like, hey man, are you okay? Have you thought about hurting yourself? Have you thought about suicide? Those things. And we need to, as veterans, band together and help each other. And if you want to be, a supporter on this, you can support the podcast. You can support the clinic. And push this out there. This is why we're doing this video, is to push so that people know that there's resources out there. MVP, the same thing. There's going to be a lot of different resources. And if you know people in your area and you want to collaborate with these two gentlemen, reach out to us, reach out to MVP and reach out to Ketamine SLC over there in Utah. So again, I just thank you guys for viewing, listening in. Please subscribe, like, share if you want to support this podcast. And then also I want to thank our guests for doing what they're doing and serving not only the veterans, but everybody in mental health and suicide. We have to solve this problem together, guys. So again, thanks Auric and thanks Doc for being a part of the Righteous Dad podcast. Until next time, stay righteous.
All right. Much love, guys.